So my name is Janet Valuk, and I am with the Nashua Prevention Coalition, which is a community-based coalition, and our fiscal agent is the United Way of Nashua. So thank you very much to the United Way for helping us out. And now I work under the Prevention Coalition operates under a federal grant, a drug-free communities grant that will be done with our 10-year grant at the end of September. Right now I'm working under another grant that comes through the Department of Health and Human Services, the Tobacco Prevention Cessation Program, and it's to work specifically on vaping. Since a few years ago, pre-pandemic, it was a huge problem. And then when we got the grant and decided that we were going to participate in it was March of 2020, so right when the pandemic hit. So we did the best we could with the situation that we had, and we were still able to get information out there and educate people. We did offer a remote Zoom presentation that one person showed up for. So we were hoping by doing this in person and being the problem that it is, especially in the schools. You guys are all in college? Yes? Any high school students here? Any parents or family members of high school students? Okay. So I actually was just with some people this morning, and one of them was the SRO at Nashua South, the school resource officer, and she just reiterated what a huge problem it is in the schools. So we were hoping to get a lot more parents here, especially, because that's the one thing that we're working on is education and trying to educate. So this project that I'm under is called the VAPE Project, Vaping Awareness, Prevention, and Education. So the coalition has been in existence for about 15 to 20 years, if not more. And we are, as I said, a community-based coalition. We partner with all of the different agencies in Nashua. We work with the colleges. We have a couple of interns that have worked with us through Riviere. And we went in and did a couple of trainings with some of the nursing students at Riv. So, we work with the police department, the fire department, the hospitals, all of the different agencies, treatment recovery, other prevention agencies that are local in the area as well. So with that being said, if you have any questions about the coalition, I would like, before you go, if you could just sign in down here. And if you would like more information about the coalition and what we do, you can easily just check more info. I promise you, we don't sell your emails. We will only put you on our distribution list that will tell you about our upcoming meetings and some of the events that we're working on if you might want to participate a little bit more. All right, so we have 4 panelists from the community. First, we have Lyndsey Bond, and this is not in the order that they're on the screen, but I'm going to go in the order that they're sitting. Lyndsey Bond is the epidemiologist for the city of Nashua, and she's going to start off the presentation and talk about data. Unfortunately, even though she loves data, not everybody does, but it is very important, and it definitely drives what we do as a coalition. Next, we will have Dr. Albee Budnitz. He's going to talk about the dangers of vaping and tobacco in general as well. And then we have Elizabeth Harwood, who is from Riviere University, as many of you know. And last we have Lindsay Murphy, who is from the Greater Nashua Mental Health. And she's going to be talking about protective factors that parents and siblings, a lot of you probably have, even though you're students, you may not be married, you may not have children yet, but someday you might. Or you might have younger brothers and sisters that you are definitely, as an older sibling, probably their biggest protective factor. So she's going to talk about some of that. All right, so at the end of each of the presentations, there will be a slide that will ask for questions. What we're going to ask is that you wait for questions for the end, if you have any. And then we'll do that at that point. That way the PowerPoint will flow, and hopefully, who knows, we might even end up finishing a little bit earlier than the 8 o'clock time frame that we have set. Once again, there are, did you all get a raffle ticket? So you have a pretty good percentage. I have 5 $25 gift certificates for Main Street Gyro. Main Street Gyro has been a huge partner of ours, have participated in the Prevention Coalition for quite a long time. So we were happy to support them, locally owned restaurant here on Main Street, obviously, Main Street Gyro, that serves delicious Greek food. We have a bunch of brochures and pamphlets. We have some samples up here. We have giveaways, stress stars, lip gloss, wristbands. Please come and take some for yourselves, your kiddos if you have them. All right, so here we go. First on the list is Lindsay, and each of them will give you their credentials. We didn't put them on the screen because it would have taken up a lot of space. And Lindsay Bond is not, well, she is the person in charge of the data, but that's not her credential. She has better credentials than that. Okay, so here you go, Lindsay.
Hello, everyone. So my name is Lyndsey Bond, and as Jan had mentioned, I am the epidemiologist for the City of Nashua Division of Public Health and Community Services. As far as my credentials go, I have a master's in public health, and I'm actually currently going for my doctorate in research around substance use and environmental factors that increase the likelihood of substance use overdose. So I know a lot of people, when they hear epidemiology, they immediately jump to infectious diseases, COVID-19, but in fact, many EPIs work in kind of the range of substance use and harm reduction. So happy to be here tonight. So I will get started. So for my presentation, I'll be talking about the Youth Risk Behavioral Health Survey and what it says about youth in the Nashua community and also in New Hampshire. And it's an opportunity to assess youth behaviors and experiences. So anything from mental health related issues, healthy habits, like how much does a teen sleep at night, and healthy eating, substance use, and sexual behaviors. It also shares some basic demographics like gender, age, race, ethnicity, and it is completely anonymous. So when students take this survey, there's no way to identify them, and the CDC and the high schools try their best to make it so that it's unidentifiable. So even if there's small numbers, they won't share them because that's considered identifiable. And who participates in the YRBS? So across the country, we have high school students that participate, mostly public schools, and then some states also have some middle schools participate. So we have Nashua that participates, and I believe Milford also participates in New Hampshire. These surveys are done every 2 to 3 years in the high schools and middle schools. And for middle school, that includes 7th and 8th grade student. So first I'll go over youth vaping in the US. So what we saw over the last several years with YRBS data is that we have had some fluctuation in percent of students that use vaping products. So as of most recent survey in 2021, we had 18% of high school students that reported using a vape within the last 30 days. In 2015, we had 24%, 2017, 13%, and 2019, 33%. So a little bit high in 2019, but it seems like it went down this most recent survey year. Next slide. Okay, so the survey says, if any of you know Family Feud, I'll show the results now for what we saw in New Hampshire high schools and in Nashua middle schools. So for New Hampshire high schools, we did see definitely an increase by grade when students started using vape products. So the first question is, have you ever used a vape in the past? This could be any time, even if it's just once. And if you look at 9th grade, very small percent I believe it is 19% of students said yes, they had used a vape product previously, and 81% said no. And then we move up to 10th grade, you see 27% said yes, and 73% said no. 11th grade, 35% said yes, and 12th grade, 44% said yes. So over time, you have an increase of the number of students that have at least tried a vape once, and a decrease in the number of students that are inexperienced with vapes. And then the next question that was asked was, have you used a vape within the last 30 days? So this would be students that use pretty frequently. So for this one, it asks, within the last 30 days, how many days have you used a vape product? And for the number of students that reported they didn't use a vape product at all, that was 84%. For 1 to 2 days within the past month, 3%, 3 to 5 days, 2%, 6 to 9 days, 2%, 10 to 19 days, 2%. And then when you move up all the way to all 30 days, which would be someone that uses it frequently, it was at 5%. The next question was, how do students get their vapes when they did use within the last 30 days? So this was only students that reported using a vape within the last 30 days and how they had gotten it. So for this one, most of the time it was a friend or family member, with 9% of students reporting that they had gotten that vape product by a friend or family member going to the store and buying it for them. 1% reported getting it from a vape or tobacco shop, and only 0.1% reported at a mall kiosk. We have 1% that took it from a store, so they stole it. And then the second most frequent was some other way, which could be a number of things. This was a survey, so there wasn't really an opportunity to specify as to what that some other way was, but something to keep an eye on as we look at how students are getting these products. So next I'll be talking about the middle school, so Nashua middle school data specifically. So for students who have ever used a vape product, we had 15% say yes and 86% say no. So just to clarify, this is 7th and 8th graders using vape products. So 15% reported already using a vape product in 7th and 8th grade. The next question was, have you used it within the past 30 days? So very similar to the high school survey where they had asked the frequency of vape use. So for students who reported using it within the past 30 days, only 7% reported it, and the other percent was 93% said that they had not used a vape product within the past 30 days. So there's also a comparison to, they were able to compare 7th and 8th graders, even though that may not seem like an big age difference. You have 8th graders going into high school where they might be more exposed to vape products. So for 7th grade, who have ever used a vape product, there was 11.8%, and then for 8th graders, it was 17.3%. As previously mentioned with several other questions, have they used within the last 30 days? You have 7th graders using almost 6% and 8th graders using a little bit over 8%. For students who used a vape 3 or more days within the last, or 3 or more times within the last 30-day period, so a little bit different from the high school survey where they had asked how many days, this is just how many times they've used. 48% said that they had used more than 3 times if they reported using within the last 30 days. And then 52% said that they did not use more than 3 times if they had used within the last 30 days. This seems like a big number, but it's not the whole student body. This is only students that reported using within the last 30 days. And for the next question, students who had used more than 3 times a day within the last 30 days. So previously we talked about 3 times or more within the last 30 days. This is 3 times or more within a day in the last 30 days. So for 7th and 8th grade, 8th grade was higher, which is kind of expected with most of these data points. So for 7th grade, it was a little bit over 40%, and for 8th grade, it was a little over 50%. And that's all I have. Thank you.
Okay, am I on? No. Hello? Oh, there we go. There's a magic person in the back room that turns everything on and off. So thank you very much, Lindsay. And I think the important thing to remember is that as a prevention coalition, we would like all these numbers obviously to be zero, especially when it comes to some of the middle school students, that these kids are probably 13 or 14 years old, and they're already indicating that they've been trying some of these substances. All right, so next we're going to move on to Dr. Albee Budnitz. He's a longtime coalition member. He also works with Breathe New Hampshire, and you can share the rest of your credentials if you'd like.
Okay.
Okay, all right, thank you.
The first thing I'll say is excuse my voice. It went away totally Sunday afternoon. The first time this has happened since well before COVID, but it happened for this. So I'll try to speak quickly so you don't have to listen to this too long. My credentials wise, I did internal and pulmonary medicine and critical care for 40 years in Nashua, 5 years in Rhode Island, and then I retired 5 years ago, so that kind of dates me. My grandson, who went to this school, is graduating college next month. That sort of dates me as well. Anyway, we're going to talk about the dangers of youth vaping, and here we go. I'm going to talk a little bit about all these subjects. I'm not going to go through them with my voice. We'll just get right into it. Tobacco health effects. In general, this relates to cigarette smoking, but any combustible tobacco has been the #1 preventable cause of premature death and disability in this country for over 35 years. Almost 500,000, that's 500,000 deaths a year that tobacco and nicotine directly contributed to tobacco. It does all these other things, which I'm not going to go into, but essentially the killers are cardiovascular disease, respiratory disease, and cancers. But it does affect every organ system in the body, and there's a bunch of other things there which we won't get into. This is from Public Health England from about 3 or 4 years ago, and 40% of smokers felt that nicotine was the cause of these killers. And the first myth to get rid of is nicotine is not a prime cause of cardiovascular disease, respiratory disease, or cancers. It is a co-carcinogen, and it does have effects on the cardiovascular system, but those deaths are not caused by nicotine. Tobacco products, I could do an entire hour with just pictures of tobacco products, but here's a list of those, and tonight we're going to talk about vapes. The one other one I wanted to highlight was heated tobacco products, since those have taken off in Japan. The market here is not taken off as much, and it probably won't affect youth. It's mostly aimed at adults. They're little heated tobacco sticks, but they're new and they're coming on the market. There's literally over 500 devices, and that's lumping them. That's not splitting them up, of these amazing, really, electronic cigarettes or vapes out there, and there are more every day. And that more than 15K, more than 15,000 unique flavors are out there right now. So it's really hard to regulate these things, since the only regulation they have is to make more profit. And anybody can certainly, in the question and discussion period, ask me about any of these things, and I can back them up. This is the evolution of e-cigarettes. They came into this country in 2007, looked like a cigarette, was to help people to quit smoking, invented by a Chinese pharmacist, actually. And the second generation were vape pens, and neither of those are used much. They use free-base nicotine, didn't get the nicotine to the brain the way cigarettes do, so they didn't work very well. But the third generation, it's used by a small peer group, less than 20%, but if you've seen the big plumes of aerosol coming out at the traffic lights and all the neat tricks you can do with it, I have a video of one of those, but not tonight. These are the mods, and they're called mods because they're modifiable. They have very more powerful lithium batteries, and you buy your e-juice separately, and you put or e-juice or e-liquid, you can put it right on the heating coil, and really get a high hit and do all kinds of neat tricks. So that has caught on, and they now use e-juice with nicotine salts in them rather than free-base nicotine. Important because if anyone's tried smoking a cigarette, you may sound like me. I sound like all the time if you've smoked long enough. It's very harsh. It makes you nauseous. And most initiation is between 7 and 9 years old. Addiction isn't usually till mid-teens, around 14. But it's pretty harsh, whereas these things smell and taste really good, unfortunately, the e-juice. Anyways, the fourth generation, the big daddy was Juuls, and they, up until 2019, had about 75% of the market, or a little bit more. And then the administration at that time, December 2019, put in a law that said there was no more flavored Juuls to be sold in convenience stores. A number of loopholes were there, but Juuls lost their market share within 30 days, in the middle of January 2020. So-called disposables will look just like Juuls, except you only used them once, although many of them now have 1,000 hits of nicotine in them. And you just use them and you threw them out rather than buying the refillable cartridges. And all of these fourth generation and beyond use nicotine salts, and I won't get into the chemistry of it, but they're much less potent than free-base nicotine in cigarettes, but making them acidified and adding flavors makes them not only not harsh, but they're actually very pleasant. They smell good, they taste good, they're smooth. Whether they give you a voice like this, I'm not sure because they haven't been around long enough. But they also mimic the hit of nicotine to the brain that a cigarette does. The first product to do that. So it gets to the brain very quickly. We'll talk about that in a moment. But they do have some problems, and we'll talk about that as well. So what's in this aerosol? First of all, vapes are not water vapor like what comes out of your teapot or your simmering soup. Vapes are an aerosol, and aerosols are devised to deliver chemicals to a target, whether it be hairspray or spray paint or what in medicine, inhalers like asthma inhalers and COPD inhalers, they deliver chemicals, in this case, to the lungs. Which in turn gets it everywhere else. There are about 30, 50 chemicals in vapes. Stanford has done work on that. And they all have flavorings. They all have propylene glycol and vegetable glycerin and diacetyl is the flavoring for buttered, microwave buttered popcorn. And all of these have been FDA approved for ingestion, but none of them have been approved for being heated and inhaled into the lungs, and their chemical composition changes. And CDC did a study now several years ago in 2015. They just got a whole bunch of vapes from convenience stores, and over 99% of them had nicotine in them. That's probably changed a bit now, but nicotine is where we're going to go. And I'm going to start and end with this in a few minutes. And if you get nothing else out of it, the use of vapes or e-cigarettes is unsafe for kids, teens, young adults, pregnant women, and non-smokers and non-tobacco users. Everybody in the scientific field agrees on that. If you're not using tobacco in any form, please don't start. It's an addicting drug. So that's an old slide, and it hasn't changed. That's from the National Cancer Institute in the 90s. You don't have to read all this. It's just a couple of points on this. Nicotine, up until about 2 years ago, the most cost-effective way to get it so you get a return on investment was from the tobacco plant. Supposedly, synthetic nicotine came out about 2 years ago, 2021, but you really don't have to worry about that because a year ago, in April of 22, anything with nicotine in it is regulated as a tobacco product, as I think it should. Nicotine is a drug, so it has different effects in different doses. In a small dose, it's a stimulant and does other actually pretty neat things. But in a high dose, it's a sedative. At a very high dose, it's poisonous. It can be fatal. And in almost all the doses, well, I should say that, in all the doses on the market right now, it's highly addictive, especially to kids' brains. We'll talk more about brains. She's the brainy one here, so she'll talk more about brains. This is about cigarettes. That cigarette was and still is the best delivery device for medication that we know. And the reason for that, it gets, in this case, nicotine to the brain very quickly, 10 seconds, give or take. and it can be controlled by the smoker as to how much nicotine they need for their hit. That's the difference from e-cigarettes. The cue for controlling the dose is not there, even though they get the nicotine to the brain very fast. Cigarette manufacturers, the Marlboro people and the Camel people and the Newport people have engineered cigarettes to get more and more nicotine so they can get people hooked quicker and easier. And they do that with adolescents and teenagers and anyone without a fully developed brain, which is everyone below the age of 25 or so. And therefore, they have a customer for as long as they're alive. Now, they don't live as long as anybody else, but if you're dying in your 40s to 60s and you're 20 years old or 16 years old, who cares what 40 or 60 is, let alone someone who's ancient like I am. But if you look at this list of substance uses, one use of tobacco will result in addiction more than any of these other substances. I won't read them down, but you see them all there, and that includes heroin and cannabis. Again, it gets to the brain very quickly. It affects the so-called reward system or the mesolimbic system, and then it puts out chemicals like dopamine and endorphins and serotonin and a whole list of others that all result in you feeling really good. And just look at the very top of this slide. This is a drug that, if you take it in the right dose, reduces anxiety and stress and depression at the same time as improving the feeling of well-being, so you're not depressed, mental acuity and alertness. And that's a great drug when you think about it. It does a bunch of other things which we won't go into. This is the main thing we're talking about today, nicotine in the brain. Unfortunately, it only lasts about 30 to 120 minutes, 30 minutes, half an hour to 2 hours. And then it comes out of your system, and the withdrawal symptoms are on the right-hand side of the slide. And they're the same symptoms that you had to begin with, that you were treating with the nicotine. So in the pandemic, kids are stressed and anxious and depressed. They got hold of a Juul or now a puff bar, the disposable e-cigarettes. They get a puff, and they really, within 10 minutes, they get a hit in the brain within seconds, but within 10 minutes, they start feeling less depressed, less stressed. But within 30 minutes to 120 minutes, they feel twice as depressed and stressed because they're getting the withdrawal symptoms from nicotine plus their own symptoms. Makes it really hard to quit. Busy slide from Dr. Tansky, who I work with up at the Coop Institute at Dartmouth. And unbelievable person if you ever get to listen to her. She's a pediatrician at Chad. And two things on this. Anecdotally, because the data is not robust yet, she feels the trajectory from initiation of nicotine use with e-cigarettes to addiction is quicker than it is with cigarettes. And again, with a late generation e-cigarettes, the fourth generation with so much nicotine in them, you lose the cue for dosing. So people who smoke cigarettes, some need a pack a day, some need 5 cigarettes a day, some need 2 packs a day to get those great effects I told you about, reduce stress and anxiety, increase feeling well-being. And very few nicotine poisonings. With the fourth generation, that they haven't figured out how to give the person that dosing cue so that they don't get actually nicotine toxicity. In any case, all of these drugs that are listed, and nicotine continues to meet all the criteria, which they've changed slightly in the last 35 years, but they're the same stuff. And now they're kind of splitters, so they're more specific about it. But all the criteria for a highly addictive chemical. But just to show you, back in '88, and I was lucky enough to meet and work with Dr. Coop for about 7 years. His Surgeon General's report said that nicotine was addicting like heroin and cocaine, and they also studied alcohol. This is work by Dr. Chatty, who was at Boston Children's. He's now up at McGill. And the short-term effects we've already talked about, gets to the brain real fast, the stimulant, gets to the pleasure center, makes you feel good, and it's addictive. The long-term effects include impairment in attention and working memory, mood disorders, poor impulse control, but the worst long-term effect, it increases the risk for substance addiction, whatever the substance is. And that includes opioids, alcohol, THC, and cocaine, all studies done in the last 5 years. But in my case, I think nicotine is the worst because About 20% of these kids these people go on to use so-called dual users. Now, the range is very wide, but I think 20% is a conservative estimate. And dual use means e-cigarette and a combustible, and 90% of the people who use dual use cigarettes. And then we talk about the number one killer of preventable death at a premature age. The toxicity you get with the e-cigarettes, all the nicotine includes stomach ache, dizziness, headache, decreased concentration, risk to the brain and behavior, and the aerosol, which is irritating to your bronchial tree, addiction in the dual use, which we talked about. Now, these things taste good, and some of them come pre-filled, like the Juuls, and many of them come, you get the e-juice separately, and if you happen to spill it on the table, it smells good and tastes good. And if any of you have ever had kids, toddlers know the world through their mouths, and they get the world by putting their hands in their mouths. So they scrape up the sticky, sweet, good tasting e-juice and put it in their mouth. And little animals do that too. You see dogs and cats doing that. Well, if they weigh less than 50 pounds, they have 2.5 cc's, which is a half of a teaspoon, it can be fatal. So calls to the Poison Control Centers of America have gone up from about 200, 270 a year in 2010, and even before that, very high nicotine e-cigarettes came out, vapes came out. In 2014, it was up to close to 4,000 calls a year of nicotine poisoning. Now, I don't have data since 2014 from them. Nicotine is a gateway drug. This is my second to last topic. And as I said, the brain is the very last organ to develop fully in the body. It develops from the back to the front, and the front is the prefrontal cortex, which develops last, and it develops around the age of 25, as I think I already said, and for some reason, girls a few years earlier, I don't know why. Maybe you can tell us why. And the prefrontal cortex is our center for rational thinking, for executive function, for making judgments about taking risks. That's not developed until you're 25. So if you actually went by scientific data, any addicting drug should be illegal until you're over 25 years old. Then you would reduce substance use, according to Dr. Sharon Levy. This slide is hers. She's the head of pediatric addiction at Children's Hospital of Boston, by 99%. But I'll take 21, because that reduces it by 95%. But before that, the developing brain is susceptible and vulnerable and primed to get addicted to any of these substances. And this is her slide, which I like. It just shows the rational thinking gap. And as an adolescent, your reward center is totally developed, but your rational thinking center isn't developed until 25 or maybe 55 if you're a guy. And somewhere in between there is the rational thinking gap. So in the 90s, there's a picture, a stock picture of teenagers in the 90s. If they smoked, they used these other drugs that much more that you can see on the slide. And a stock picture from now, teenagers. They do all of that, plus many studies, although the data is a little bit skewed on this, will go on to combustible cigarettes within 18 months. Combustible tobacco products, but mostly cigarettes. And the more nicotine, more smoking, and vaping, according to a study that came out from in JMA Pediatrics from the University of Southern California, and these products have a ton of nicotine. A Juul pod, they thought, had about the equal to a pack of cigarettes, but it's probably closer to 2. And some of these others that say 5 or 6 or 8% nicotine have nicotine salts that are just equal to 3 or 4 packs of cigarettes. So it's very easy to get hooked. So vaping is still an epidemic, despite the way some people look at statistics that have just come out from the new PATH study. My medical society, our medical society, New Hampshire Medical Society, sent out something that was a quote from the president of the vape industry of America. I have to get to them and take that away. But yes, people are vaping less now than they were in 2019. Kids are, just as we just heard. But those who are vaping are vaping more intensely. Anyway, the bottom line is that if they vape, they can go on to smoke cigarettes and die prematurely. I don't want you to read this slide, but For reference, the Truth Initiative is a great place. You can Google it or go to thetruth.com and get some great data. One study they did showed that 80% of kids or young adults who started, 15 to 24-year-olds, who started vaping to reduce anxiety and stress, when 90% of those who could quit actually felt less anxiety, stress, and depression. And in the last 5 years, another study that came out is e-cigarettes with huge amounts of nicotine have increased 15-fold. One slide on harm reduction, in case you hear it. Isn't this something great as a nicotine replacement therapy instead of gum lozenges or a patch for adults to quit smoking if they haven't been able to? Possibly. So that's possible. But we need more regulations of the vapes so that we know what we're inhaling. And then the other thing that's old and has come out again with the FDA in the last year or so, but was first published in the 90s by Dr. Budnitz, who was up here at the Coop Institute just about not even 2 years ago, is that you can reduce nicotine to a low enough level that's not addictive. Unfortunately, there are no products out there right now that I'm aware of that are that low. So the health effects are protein. Nicotine is what I want you to remember. It does affect the respiratory system. We've all seen the acute lung injury that sort of came and went prior to the COVID. That had to do with a lot with THC and its diluent, vitamin E acetate, so I'm not going to talk about that or anything else. Chronic effects, we don't know. Our bodies are amazing. To get COPD or lung cancer, you have to smoke for 20 to 40 years, and we don't have data on that in e-cigarettes. So I'll end with, we all agree that youth, young adults, non-smokers, and pregnant folks should not use any tobacco product. I'll put a plug in for against vapes because they should not be used because they are bad for the lungs, and other things could be vape. 5 years ago, or 7 years ago, kids were starting to use marijuana in vapes, and so I'll pass it on to our next speaker, who's going to talk about vapes and marijuana in the brain. Thank you.
Okay, thank you very much, Albee. Just a quick survey. How many of you in the audience are under 25? Raise your hands. So the majority of you. So you still have a developing brain there, so important information that we're sharing. Okay, next.
I'll just say one more thing. These are two of my grandchildren. The one on the right was the one who graduated from Nashua High North 4 years ago. He's now 6'2". He was 4 then, and this is my granddaughter who was 4 then. She's now 11, and they have to wear uniforms in England. She and her family live in England for the last 20 years.
Okay, so thank you, Albee, very much. We appreciate it. All right, next on the agenda, we have Dr. Elizabeth Harwood from Riviera University, and she will give you some more of her credentials, if there are more.
I think that about sums it up.
Okay.
My PhD's in clinical psychology, and I'm the department coordinator for psychology, human services, and social work at Riviera University. And I'm so excited to see several of my students here. So I'm going to talk a little bit about marijuana and how it affects brain development. So the Monitoring the Future survey is administered to 8th, 10th, and 12th graders every year. And so this gives us a sense of how much students are using marijuana. And so within the past year, we can see that about 30% of 12th graders have reported using marijuana. And about 20% of those have been vaping marijuana as well. You can compare this to alcohol use, which is about 50% by their senior year. So one of the important things to consider about marijuana is it really depends on the strain and the concentration of THC and CBD. So when you're looking at marijuana, there's hundreds literally of cannabinoids. THC is the one that causes the high feeling, the euphoric feeling that's associated with marijuana, whereas CBD, I'm sure you've seen it in different shops. It helps with anxiety, insomnia. There's some research suggesting it helps with inflammatory disorders as well as childhood seizures. But CBD does not cause a high. And so it really depends on how these two balance one another out. So if you have high THC concentrations, but low CBD concentrations, that's where you're going to see some of the more severe side effects. anxiety, paranoia, perhaps hallucinations. So if you look at recent marijuana batches that have been seized by the DEA, you can see that the THC concentrations have been slowly increasing, while the CBD concentrations have been slowly decreasing, leading to some significant side effects from use. So the main message here is not only do we want to balance those two out, but the marijuana today is very different than the marijuana from the 60s and 70s. It's much more potent. So one way to use is through inhaling joints, blunts, bongs, or vapes. So if you compare it to the 1990s, when it was around 4% THC, now they're seeing samples closer to 15%. There's also edibles where you can eat it in food or brew it in tea. And here it's very, very hard to determine exactly how much THC you're getting depending on how you create the product, and also it has to go through the process of digestion. And then finally we have concentrates. So concentrates, often called dabbing, these include things like hash oil, which is like a gooey, sticky substance, wax, which looks a lot like lip balm, and then shatter, which is more of an amber-colored, hard product. These concentrates have incredibly high amounts of THC, probably around 50%, right? So that's a lot different than what we were using in the past. There's been some evidence that these products contain contaminants, residue from pesticides or from solvents as well. But the other thing to remember is when you're using a concentrate, when you're dabbing, you're getting all of that THC in one hit versus inhaling or smoking a joint. Now, how it's administered matters. If you inhale it, it's pretty quick in terms of its effects, and it lasts anywhere from 1 to 3 hours. The problem with edibles, though, is it takes anywhere from 30 minutes to an hour to actually feel the effects of edibles. So if you take someone who's really inexperienced and doesn't know that, i.e. teens, they might think, oh, it's not working, so let me eat some more, and let me eat some more. And then all of a sudden, they're getting hit with a really high dose of THC because of that. The other issue that you can see is obviously a lot of these looks like gummies or cake or cookies or brownies. So a lot of children might accidentally ingest these marijuana edibles, and that's been leading to higher calls of marijuana poisoning, which can include things like problems walking, sitting up, and breathing. So obviously that's a concern. You want to make sure that if you do have marijuana edibles, you keep them locked up and safe from kids. So in terms of how does it affect the developing brain, like we've talked about before, our brains are still developing, and so it matters when you start, right? If you start before the age of 25, that's going to lead to long-term effects compared to if you start after the age of 25. So just to give you a sense of the different areas of the brain that are affected, it affects, for example, memory and attention. We'll talk a lot about that in a minute. Motor movement and reaction time, so it affects your driving abilities. It, depending on how much you take, it can either make you feel less anxious, or paradoxically, it can make you feel more anxious. It also increases appetite. And then this one's a little bit controversial, but essentially it hits the reward center of the brain, so people enjoy the effects of marijuana. So when someone's using, we can take a look at how does it affect us emotionally, behaviorally, or physiologically. Emotionally, when we look at marijuana, the euphoria and the relaxation is why people take it, but it also can increase your sense of well-being. People feel like things are really great when they're under the influence. It also slows down the perception of time. One of the biggest concerns, though, is the impaired working memory, thinking, problem solving, and executive functioning. All of this, which can last for quite some time. And then it can also cause increased sensitivity to sound, taste, and textures. Behaviorally, there's a loss of coordination and balance, a slower reaction time, fragmented speech, so it might be hard to follow what they're saying, and impaired driving ability. So in particular, I've had a lot of students remark, for example, well, I concentrate so much better when I'm under the influence of marijuana. Well, actually, you may think you are, but you're probably weaving in and out of lanes, having reduced reaction times, and the risks of crash increase. Physiologically, some of the things to consider is that it can increase your heart rate and blood pressure. It has some stimulant-like properties. So if someone has an underlying heart condition, that's problematic. It could also create bloodshot eyes. That's one way to figure it out. And it irritates the lung, which can lead to breathing issues if they inhale it. And then I'm sure you've heard about, prior to the pandemic, there was a serious lung illness associated with vaping marijuana. So looking at the evidence on memory and learning, even though you may no longer be high, the acute effects wear off, the effects on memory and learning can linger for several weeks. So executive functioning is what helps you plan ahead, think ahead, prepare, impulse control. And so these are all the things that are still developing up until our age of 25. So if you were to vape early, often, and intensely, this can have long-lasting impacts on one's executive functioning. They compared people who started before the age of 22 and people who started after 22, and that they really found that comparison that when it's before the age of 22 is when you see the long-term impairments. Compared to an adult who's using marijuana, it's less likely to linger. One good other potential issues can include anxiety, paranoia, and hallucinations under the influence, especially if the concentrations of THC are high. But there is an association with marijuana and schizophrenia. It's important to note that you're not going to develop schizophrenia if you don't have an underlying genetic basis for it, but you can think of marijuana as potentially initiating that risk factor for you. It also has been correlated with social anxiety and depression in youth. And I don't know if anyone's heard of this before. Some people were showing up in the emergency room having severe nausea and vomiting and dehydration, and that was a result from long-term marijuana use. So that's a particular syndrome associated with it. And then finally, is marijuana addictive? My students like to debate me on this one. But just to keep it in mind, if you have a heavy dose, then tolerance can happen, and there are withdrawal symptoms. Now, granted, if you're comparing it to opioid withdrawal, it's not nearly as severe, but it's still present. So irritability, stomach pains, anxiety, and increased appetite, loss of appetite. And then there is marijuana craving, but it's milder. Nonetheless, about 5.1% of people 12 and older have a problem with marijuana use disorder. This increases to, so if you're using marijuana, it's 9 to 30%, and increases to 17% if you start young, and if you're a heavy daily user, then it's anywhere from 25 to 50%. So there's still a significant proportion that has a marijuana use disorder. And then before I end, I just wanted to mention synthetic cannabis. This is man-made cannabis called Spice or K2. And essentially all it is they take lots of different herbs to make it look like marijuana, and then they spray it with a bunch of different chemicals that cause effects that are similar to THC, but they tend to be much, much stronger. So in terms of the Poison Control Center and the National Institute of Drug Abuse, here are some of the side effects: severe agitation and anxiety, fast racing heartbeat, nausea, vomiting, muscle spasms, seizures and tremors, but also intense hallucinations and psychotic episodes have been reported, as well as suicidal and harmful thoughts as well. So synthetic cannabis was popular in the past before it became a Schedule I drug, but most people who have used synthetic cannabis say they would much rather use marijuana because it's just too intense and unpredictable how that will affect it. And there we go.
Thank you very much, Lindsay. We really appreciate it. So just to follow up on the whole marijuana thing, down on the table we have a few samples of devices that look like tampons, Arizona tea, Pringles, a light bulb, a bolt, and a package of gum. And they are all basically devices to hide your drugs in. So at the end, again, you know, we invite you to come down and look at some of these. Again, it's to let parents know, or people at work know what things might be hiding and you don't even know it. All right, so moving on, last but not least, we have Lindsay Murphy from the Greater Nashua Mental Health. She will give you her credentials and let you know her position there and cover protective factors that you, as I said at the beginning, either a parent or with younger siblings or soon-to-be parents, can keep in mind to, you are the number one protective factor in your little brother or sister's life or your kids' lives, or in your grandchildren's life.
So my name is Lindsay Murphy. I'm the Associate Director of the Child and Adolescent Family Services at Greater Nashua Mental Health. I'm a licensed clinician there as well, and similar to the other Lindsay, I'm just finishing up my dissertation working with parents and late adolescents and different parenting styles. So similar. So I'm here to talk about some of the risk and protective factors. I will say that Greater Nashua Mental Health participates in an evidence-based practice called 7 Challenges, which looks at substance use in teens. It's quite an amazing program in particular because it's a harm reduction model that really looks at making intentional decisions about why adolescents use. So it continues to grow more and more evidence in terms of its empirical data on the outcomes and how successful it is. So risk factors. So when we're looking at what starts an adolescent from considering using, as you saw in the data from the very beginning, we're talking about 7th grade, and you saw it increased in 8th, 9th, 10th, 11th, and 12th. So we're really looking at what are those initial risk factors that start. So we know that stress and anxiety, health issues, family history, previous episodes of mental illness, substance use in the family. There are cultural factors that are involved, seasonal changes, abuse. Many of us have heard of the ACEs, so we know that that is significantly linked to the start of using various substances at a young age as well. So all of these are risk factors. They are not predetermined, though. It doesn't mean that just because you have one or any or all of these that you are going to end up choosing to use a substance. It's just, it increases the likelihood of you choosing to use a substance as a coping skill. That one? All right. So here are some things that are work in opposite of our risk factors. So things that we understand that decrease the likelihood of adolescents using substances to manage their stress, depression, or anxiety is a healthy lifestyle. And that doesn't always mean you have to go out for a run. It just means participating in something that gets you physically active. Because as that was mentioned in both of the brain discussions, we're talking about a reward system, a dopamine, the neurotransmitters that are released that feel good. That also comes from a healthy lifestyle. It comes from those aha moments when you're walking through the woods and you see something pretty or you are doing some type of physical exercise. That same kind of reward can be released. Positive self-esteem. Unfortunately, so many of our adolescents, sorry, but it's true, social media doesn't help, affects self-esteem. And so increasing self-esteem, self-confidence, self-efficacy, self-advocacy, all of those self-determinants also are protective factors. Feeling in control of your life, there aren't a lot of things, especially coming out of COVID, that we felt that we had a lot of control over. The things that you can control also help. Abstaining from substance use, being consistent, other things that support a strong support network. So one of the things that was mentioned earlier was looking at how can siblings help. So we understand that in the moment when you're feeling depressed or anxious and you decide to vape, as we just learned, the nicotine immediately gives you that like, oh, I feel better, and then within 2 hours, I don't feel better. When you have a strong support network, if you are a sibling or have friends or family that you can turn to, using them in those moments of depression and anxiety symptoms that are decreasing is less likely than that you're going to turn to the nicotine because you have someone else to talk to you, someone else to support you. School attendance is huge. We all know that working with schools is a huge way to decrease use. Often, the most trusted adult in an adolescent's life is someone in a school. Economic security, absolutely. We know the financial hardships as well as food insecurity play a huge part in the stress that our adolescents are feeling. Pro-social activities, that can be within your community, going to PAL, going to the YMCA, participating in all the great opportunities that our community has, and those community connections, participating in this, and even just taking a little bit of the data that you learned tonight, or some fact that you learned about how nicotine and marijuana affect the brain, and sharing that and sharing where you heard it. That is how we begin to like make the ripple effect to make changes. So one of the things we spend a lot of time on is looking at what the bioecological model is, the social ecological model, and one of them really talks about that there are individual things that we can do, and then there's family support systems, and then community, and then, you know, nationwide. And so really when we're talking about protective factors, there are those immediate protective factors: having a good relationship with your sibling, having an open communication about substance use, and not being afraid to have conversations with it, and not in a punitive way, but in a way that is providing education and support. Often our adolescents just need language in how to address what's occurring and how to respond when asked. It's very interesting. Right now, it's really hard to say no, and even just being asked to come into the bathroom to like hit a vape, like even if they don't want to, how do you say no when social acceptance is so important among our peers? So being able to provide language that gives your student or your friend or your sibling the opportunity to be like, oh no, I can't right now because of so-and-so. It's about balancing that need for social acceptance and wanting to do the right thing. Family, community, our family and community doing these types of discussions, roundtables, providing information and education is one of the best ways to increase protective factors and reduce those risks. And then we look at going out. So the Truth campaign is phenomenal. All those other commercials that you see right now, even the social media platforms that are really pushing making different decisions and healthier decisions, they work in both ways. We see them a lot of the negative, but they also have the opportunity to be very expansive and reach many students. And that's one of the other protective factors. We have to work together as not just the state, but as a full country in order to kind of make those changes. And that's all I have.
Thank you. I probably should have mentioned at the beginning that this presentation is being recorded so that we can share it with people around and share it on our social media site so that even though they weren't able to attend, they can still get this information. So as we open it up for questions, what will happen is if you have a question, I will repeat your question so that it can be heard on the video that's happening in the back of the room. And then whoever the question is directed to, you can feel free to answer. So let's start. Are there any questions? Somebody raise your hand, please. Yes. Okay, so the question is to Lyndsey Bond. The data that she presented about vaping, is it broken out into what is actually being vaped?
So no, it does not break down the substance that's actually being vaped, but in the YRBS survey, there is a section on cannabis use, and there is a question that asks if they've used a vape product that has cannabis in it. So that's one way to determine whether or not youth are using THC vape products, but there's no specific breakdown of whether it's tobacco or THC.
Yes. So the question is there a difference between the type of vape that's being used, whether it's oil-based or water-based?
Okay. Yes, that's a good question. And the problem is as I mentioned, there are over 500 devices out there, And depending on what you have in your e-juice that you refill it with, if it's not a pre-filled cartridge or pod like Jules had, it can be very different. So the acute lung injury that came just prior to the pandemic turned out to be probably a diluent, a vitamin E acetate that made cannabis go a little bit further. Okay, make sure I was correct. Made cannabis go a little bit further, but it also is extremely irritating the lungs. The vitamin E acetate is fine for your fingernails and the propylene glycol and the diacetyl are fine to ingest, but none of them have been studied to heat and inhale where the chemical composition changes. In fact, the e-juices on the shelf often will change depending on how long they've been there, the chemical composition. So, yeah, water-based, lipophilic or hydrophilic e-juice will affect different parts differently. But there's so many of them out there that just don't inhale it. I mean, that's my bottom line. You're supposed to inhale wonderful air up in the White Mountains. That's what we're supposed to inhale.
Yes, go ahead. Okay, so the question is, what do you think about using marijuana to manage pain?
Sure. To manage pain, I think if you're an adult with a fully developed brain, I think that's a personal choice. And if it helps relieve pain where other medications don't, I personally would be okay with that. I think it's about thinking about the risks and the benefits. Every drug that we use, whether it's prescription or over-the-counter or an illicit drug, has potential benefits and drawbacks. And that's what we have to weigh. I think for an adolescent brain, the risks are really high to be using that pretty consistently over time. But for an adult brain, I think that's a different story. Good question.
So just to clarify for everybody, in case you're not aware, in the state of New Hampshire, all of these substances that we've been talking about tonight, the legal age for use is 21. Back in 2020, I think it was 2020, the smoking age, using tobacco products was raised from 18 to 21. Marijuana is not legal in the state of New Hampshire. That we have therapeutic marijuana. Some people call it medicinal, but it hasn't been proven to really be a medicine. So the state department, the state legislators in New Hampshire decided to keep it named at therapeutic. That is legal for adults that are prescribed it by a physician. And we have a few distribution centers. There's one close by in Merrimack here. Other than that, he's going to add something, because I probably left something out. But it is still not legal recreationally. It has been decriminalized, so you're not going to go to jail for possessing a small amount. And I will just give you the viewpoint from the prevention specialists in the state of New Hampshire. We are a pretty united group in that we do not want it legalized, because what that does, first and foremost, is it lowers the perception of risk. And whenever perception of risk is lowered, usage goes up. So many young people, when they first heard that vapes were a safer alternative to cigarettes, they started using vapes because, oh, it's supposed to be safer. Well, it's safer if you are a smoker and you switch to vapes, but not if you've never been a smoker. And that's where it went out of control, was that all of these young kids heard that it was safer, but in reality, they never smoked, so it's not safer for them. But that's where we stand. It is in the legislature right now. We don't know where it's going to go. We know that it's legal at every state around us. We want to be that island if we can, again, because it's the perception of risk that will definitely have usage go up. Yes, sir. Can you repeat that? I didn't hear you. I personally do not. So the question is, do I think that the state of New Hampshire should legalize it? We go by a lot of data that we hear from states where it is legal. The first states that legalized it, for example, were Colorado and Oregon, and they have had major problems. They haven't gotten the money that they thought they were going to get from it. Everybody says, well, they're going to tax it and it's going to solve all these problems. They are now looking at making it, there different towns and cities and states that have legalized it are looking at saying, sorry, we don't want it in our community, because it definitely has affected workforce production issues, mental health issues from it. They're not putting enough money into treatment for a lot of mental health issues that they're having. And again, my main concern is the youth. Sure, an adult can make that decision themselves, somebody over the age of 21, but it still will affect the young people and their perception that it's safe. If it's legal, it's safe. And so, yeah, we can use it even though we're not 21. And we know that, we're not imagining things, but where there's a will, there's a way. It may not be legal, but kids will get stuff that they want, whether it's legal or not.
Just add two things. I pretty much agree with everything everyone has said. I would only say don't inhale it. Know how edibles work and use it that way, whether it be for your pain, when you're an adult or not. And I forgot my other point.
Okay,
because I'm
that's
old.
fine. All right. Any other questions or comments? Okay, so I'm going to go down here and, so some of the stuff down here, I'm going to take the microphone and go down there. So some of the stuff down on the table, we have a couple of really good programs here in the state of New Hampshire one is called Save Your Breath and another one is called My Life, My Quit. And so a lot of the stuff that if you took lip gloss, if you took a stress star, they have little QR codes on there that you can scan with your phone. The lip gloss is for the My Life, My Quit program, which is a special program designed for young people under the age of 18, if they want to stop vaping, because there were no resources for young people. That's one thing that we are lacking. And so this little tube of lip gloss, if you did take one, and if you didn't, you're welcome to come up. It has lungs on it, and then it has a little itty bitty QR code. If you enlarge it on your phone, it'll take you right to the My Life, My Quit. So I'm going to ask all of you to be leaders, and if you have the lip gloss and you know somebody under the age of 18 that is vaping, offer the information to them so that they can perhaps sign up to quit. The star has the I think this one is the Save Your Breath campaign, which is designed for youth that are over 18 that are interested in quitting. And we also have some stuff left over, hand sanitizer, and nobody can get rid of that now, right? Everybody wanted it 2 years ago, but not anymore. And a wristband and a pencil, along with brochures here about how to talk to your kids, an age-appropriate guide for prevention. And the partnership is another good resource, the Partnership for Drug-Free New Hampshire, and how to talk to your teen about marijuana and how to talk to your teen about vaping. Also, we have a card for 211, which is basically the go-to for a lot of situations that you might be in, anywhere from homelessness to mental health issues to substance misuse, all of those things. And the data, if you're interested in data, Lindsay did put this together for us. This is kind of an abbreviation of what she presented. So it's a little one-pager that gives you information on both sides. All right, so once again, thank you all so much for coming. We appreciate it completely. And if you would like any more information, I would like you to sign your name here with your email. We can give you any information that you're looking for. And come up and chat with us and ask any questions that maybe we didn't answer for you. But again, so I think, wow, not bad. We finished 10 minutes early. So thank you very much.